Well, Dr. Zymantas, let's talk about veneers and lumineers. I personally do have some confusion, even though I talk to doctors and dentists a lot about it, and I know patients do. What is what, and what are they used for? Lumineers and veneers.
Lumineer primarily there's two different differences between a lumineer and a conventional, let's call it a conventional veneer. A veneer, both veneers are ceramic little facades that get cemented onto the front of the teeth. And with a lumineer, you don't need, most cases people don't have any shots. There is no grinding of the teeth. With a conventional veneer, you probably get a little bit of an injection because you have to grind into the tooth a little bit. A lumineer just gets you take an impression, a form of the mold of the teeth that gets sent to a laboratory, and they send back a finished prosthesis, a finished veneer that gets bonded onto the tooth. And that can make your tooth fatter. It will make your tooth fatter a little bit, and it'll make it a little bit wider in most dimensions. And so it can make your tooth look a little bulbous. Whereas a conventional veneer, when you prepare the tooth, it's prepared a certain amount or ground down a certain amount to allow the technician, the laboratory technician that's preparing the veneer, to make it ideally back to about the same contours of your natural teeth.
I got it. So on the veneer, you do a grinding, you grind the tooth down. Is grinding a tooth down a real bad thing for a tooth, or is it, in terms of getting a veneer, not really all that big of a deal, or does it damage the tooth for future use? Because that's a big question a lot of us have.
Yeah, in most cases, if you stay with the outer layer of your tooth is called the enamel layer. And if the preparation, the grinding of the teeth, you don't grind away all of the enamel, the bond of the porcelain to the tooth is extremely high and extremely good. It's a bond that may last for a lifetime. If you grind too far into the tooth, then you may have problems. But with a regular conventional veneer, if that's what somebody is going to get, then it's minimal amount of grinding to allow the technician to make a proper type of veneer to get cemented onto your tooth.
Okay. So basically it's not that big of a deal as long as it's not overdone.
Correct. Minimal reduction. Sometimes if the teeth are very, very darkly stained, or the teeth are a lot of rotation or a lot of misalignment of teeth, veneers may not be the right alternative. Some people may try it, but they may need further therapy like crowns.
I got it. So if one has only one chipped tooth or so and doesn't want to spend the money to do all of them, then a veneer can pretty much adjust that and make that one tooth pretty close to look to the other one?
Correct. If you're using a high-quality lab, your chances of developing a veneer replacement of the part of your tooth that was chipped off is very good to get an almost exact likeness to match up with your other teeth and be, so that nobody could tell the difference. With using a good lab and a good technique, it's almost imperceptible. You can't even see the difference.
Got it. But that's not quite possible with a lumineer, since the clip-on fingernail, basically, as we might want to call it, gets clipped on without grinding the tooth, and thus, no matter how thin it is, it got to be bigger than before, which means one tooth would stick out because it became bigger than before. So with a lumineer, one has to do 4 or 6 teeth at the same time in order to make them all look the same. Is that, am I getting that correct?
Yes, that is correct. Although nevertheless, sometimes people do also grind down teeth for lumineers as well. if you had an individual tooth, one single tooth with a break on it, you could not use a conventional luminaire technique without using, say, any anesthetic. You would probably have to anesthetize the patient, and they would have to have their tooth ground on to match the teeth on either side a little bit more effectively.
Got it. So what I'm getting at here, frankly, they're both the same. Let the dentist decide which one fits you and go with it.
Correct. There is a cost involved as well. It's less expensive for a luminaire than a conventional veneer because there's less work involved.
Right.
But it is patient specific, and depending on the dentist, some dentists don't have the skills, the dexterity skills to do very good, precise preparations, grinding of the teeth, let's say, for conventional veneers, so they just use luminaires.
I see. So luminaire is kind of like a company came up with a way to make it a little easier for the dentist.
Yes, exactly.
Well, all right.
Exactly.
Okay. So, thanks a lot, Dr. Zymantas. I'm sure there's
You're very welcome.
patients out there.